Milwaukee PBS is proud to present Next Avenue Community Conversations. Next Avenue brings baby boomers and beyond smart, useful information and compelling conversation. Next Avenue is made possible by the Helen Daniels Bader Fund, a Bader philanthropy with a focus on Alzheimer's disease and healthier older adults. Today from UW Parkside in Kenosha, we talk about cutting-edge technologies and their role in home-based healthcare. Our host is Mark Segrist.
Hello, I'm Mark Segrist. It's great to be with you. Well, we're talking to you from the beautiful campus of UW Parkside in Kenosha about a very important topic affecting baby boomers' health and well-being, specifically the importance of ongoing innovations in technology in home-based healthcare. Now, during the next 30 minutes, you're going to be hearing some pretty creative stuff coming from our panel of experts, and we hope you enjoy the program and you benefit greatly from it. I'm sure you will. First of all, let me introduce our special guest. We're joined by Dr. Jeffrey Lismer. He is a PhD, CEO, and founder of Vibe Tech Incorporated, based in Sheboygan, Wisconsin. We're also joined by Dr. Brian Lewis, PhD, Associate Dean, College of Natural and Health Sciences, right here on the campus of UW Parkside. Great to be with you, Doctor.
Thank you.
Also, Dr. Manish Acharya, Director of Telehealth at Infinity Healthcare, and also an emergency physician, very accomplished emergency physician at Frederick South. How about a hand for our panel of experts here? I'm so happy you're all here. I mean, this is just an exploding healthcare industry and discipline, and I'm just dying to hear your perspective in terms of, first of all, doctor, why is that so important? As a telehealth provider, why do you need these innovations and these technical advances?
Sure. So, if you think about the model of medicine, it's remained the same for decades, if not a century. Now, in the last 10 years, there's just been so many advances in technology that it allows us to do medicine a lot differently than we used to do. So there's kind of a reinvention of medicine. It's not a disruptor, so it's not like stopping you from going to Blockbusters to rent a movie and then streaming a movie. It's more about enhancing, your ability to get care. It's about getting high-quality physicians, high-quality physician extenders, nurse practitioners, therapists, to be able to come to your home to treat you virtually, as well as to being able to bring a consultant into a rural area that's underserved and being able to, provide that care that you can get in a metropolitan area in rural locations.
What is key to the success of a physician who is doing this diagnosis via image as opposed to a warm body being next to him in an office setting? This requires a different set of skills, does it not?
Yeah, absolutely. We were talking earlier, when I trained in medicine, it was 20 years ago, we were used to seeing patients and then learning about them later. So we'd get a stack of charts. It would take maybe an hour or two to receive them from medical records. And then now you're kind of catching up to the care. Now that we use an EMR, we're able to look at all the information prior to walking in the room, already gain our differential in our head of what's going on with that patient. And then we actually walk into the room, see the patient. The first thing we see is we see monitors. We see a patient. We might see a patient who's diaphoretic, sweating, uncomfortable, in pain, short of breath. And we're already now, figuring out what our differential is. And then we finally go in and auscultate their lungs and examine them. So we've already done telemedicine. Right before we actually walked in to actually touch the patient, we've done telemedicine. And that's where it's important, with training, to be able to have that higher level of expertise. So one would think it's easy for a new grad to be able to see a patient with a simple complaint and diagnose it, but what you want to try to do is exclude any of the life threats, exclude that muscle strain, which is actually a blood clot in the chest. And that comes with experience. And then, again, with the advances in technology, that we have to use pulse oximetry and other devices like that at home, we're able to get that information to the provider as well.
Okay, now Dr. Lewis, in your discipline here at Parkside, your students pursuing careers in natural and health sciences, the range is huge. I mean, we're talking about what, sports medicine to nutrition to what? It's huge.
Sure, so students who are looking to go into these types of like medical school and they want to go into those professions, they can major in anything they want as an undergraduate. Traditionally they'll major in, bio or chem. but they also major in things like Spanish. They major in communication. And so the specialty areas that they're choosing really it's just exploding. It's just wide and diverse. There's the bulk majority of our students, though, when you look at what they're looking to do for medicine, as being in the Racine-Kenosha community, we're urban,
right?
But you're 10 minutes away from rural.
Right.
So we have students that are very familiar with both. We have students who've experienced, sometimes access issues to healthcare, whether they're in the city or in the country, the country area, the more rural areas. But, they're coming from a wide range of backgrounds, a wide range of interests. And sometimes that's a healthy way for them to come into these programs. It doesn't have to be traditional, I'm a bio major, I'm a chem major. Sometimes those other skills that you get maybe in some other disciplines might actually be a strong fit for these types of, telemedicine types of interactions.
So within that range, that huge range of expertise, why is innovation so key to success, especially now?
I think the world is just changing so fast.
Yeah. And where does it need to be applied mostly? I mean, where could you really use, in what field specifically within the range of discipline that you're teaching, do we really need some technical support?
I think a lot of it could actually, so me, a lot of my background and interest is in the field of neuroscience. And I think you have a growing population of people who are past the age of 50 who are also living a lot longer based on technology, improved healthcare, improved pharmaceutical products. But some of these people, as they get older, may become very limited in terms of their ability to actually physically get to a location.
Yeah.
So I think there's a large population out there that might be suffering from some of these types of neurological disorders that could greatly benefit from this. I mean, if you think about it, I read something recently that said something like almost 100 million people in the United States suffer from some form of neurological disease.
Yes.
That's 1/3 of the population.
Yes.
At some point, it might become really prohibitive for them to be able to travel somewhere.
We're talking about basic quality daily lifestyle.
That's right.
Yeah.
So being able to have that type of technology and innovation, I think it'd be critical for their overall health and care.
Now, the gentleman to my right, Dr. Lismer, and his colleagues have done some breakthrough research. Actually, you folks started looking at a problem within NASA, and now you're able to apply the research and technology that you gained through that endeavor to folks who are dealing with all kinds of muscle-related problems. Tell us about it.
Well, I never thought that we were going to be dealing with muscle issues.
Right.
My original solution was to resolve a problem with astronauts going on long-duration space missions. And that was the second leading cause for why we can't endure long-duration missions is bone loss. And
it's an unnatural environment.
It is. Okay. It is. So a lack of gravity and a number of other factors, you're using different muscle groups. So I worked with an advisor at Michigan Tech that studied astronauts coming back from space and came up with a project concept to be able to help resolve that issue. And so by studying our natural interactions with the environment, I was able to pull those key factors that occur most frequently in a day that you wouldn't be getting up in space and created a device to apply that back to the body. And lo and behold, I just was testing it out to see how comfortable this was. 10 minutes later, with me doing nothing but sitting there and having a little bit of pressure and vibration applied at the same frequency that the muscles are contracting at, I tried to stand up and I couldn't. I'd worked my leg muscles out so much that they were completely fatigued in 10 minutes.
Really?
I said right then,
all it takes.
I need a patent and I need a company to make sure that this technology can get out there to everybody.
I mean, were you ready to draw that conclusion? Did it just drop in your lap, or?
Well, it was one of those things that it was just a key discovery that I had no idea was going to happen. But just copying what nature does and finding a way to dose it properly, and that's something that we've evolved over the years. But yeah, it was an accidental occurrence.
Okay, now help me understand the beauty of this. The way I get it is that someone can actually exercise a part of their body that is in a poor condition in a 10-minute period without taxing their entire body. I mean, by that I mean to say, if someone has different ailments within their body, they can still treat that pinpoint source without taxing the rest of their
Absolutely.
structure.
But now, when we got some funding from the National Institute on Aging, we had originally intended to just do a single leg application for helping with an acute injury. But it dawned on me that we really want this technology to help the greatest population in the greatest need. And we went right for patients that had multiple comorbidities, different ailments, those that couldn't stand and walk. And I said, you know what? They need a product that can work both of their legs. The most critical function of the human body is the ability to stand and walk.
So from there, you developed an actual chair.
Yes.
And the chair is like what?
Yeah, basically, it's a seated leg press machine. It's all robotic. We've got it instrumented with a load cell and a couple of other components that allow for very precise delivery of the key active ingredients of weight-bearing physical activity. So we've, over the years, figured out how to properly dose those to get the greatest health benefits. So in a 10-minute session, and we actually kept with that same length, and there are all sorts of good reasons for that, but just for instance, my son was using my equipment yesterday after school. He walked to my office and said, "Dad, I want to use the equipment." In 10 minutes, he gained 80% in strength, because we do measurements of strength and range of motion before and after every treatment, so you can see in real time what those benefits are. And he had an 80% gain in strength, just like that, because he's activated all of his muscles.
From a medical point of view, doctor, what do you think of this?
It sounds great. I mean, there's patients that are limited. It could be because of an ailment, hypothyroidism. They gain weight and they're not now able to, bear weight on their lower extremities, but they need to, exercise them. And then you have osteoarthritis that comes in, so it limits them from doing that. So they try swimming and things like that. But this is interesting. It's an interesting concept, absolutely.
Okay, now I would love to have members of our audience here get involved. Don't be shy. Come on up to the microphone when you have a thought or you have a question. I'd like to engage you here in our conversation as well. In the meantime, how do we go about, and I want to just toss this out for your collective input, how do we go about, okay, so we have some great technology here, and it's still developing technology. How do we still allow the patient to determine to what degree they want to have this hardware in their homes? Dr. Lewis?
Wow. I think it would all have to come down to the comfort level maybe that the patients would have in terms of their ability to still be able to be mobile enough to go into an office to get the health versus the convenience of maybe being able to do some of it at home.
Right.
So I think some of it might be a question of just maybe a fear of technology. There's some people that might just really enjoy the face-to-face interactions, but I think it would have to be, some sort of, continuum there where, you'd have to have a good level of comfort with the technology and also know that you may not be as able to get to the doctor's office or the hospital as frequently as you might need to gain the benefits of the care that you should be getting.
Right.
So I think a lot of it would come down to, at least in my mind, it would come down to that kind of balance.
Yeah, no, I agree. Technology is great. I love technology. I was 13. I used my first Apple II computer, and since then I've been using them and touching them. But there are restrictions to technology. You want to use technology when you need to use technology, and at the same time you want to have that ability. Like the physicians, we love seeing patients. We love spending time with patients. We love the ability not to be hindered by doing things that are extraneous to our job duties. So there's a fine balance as we bring on technology, and we see this in some of the EMRs, is we want to spend less time with data entry, but more facilitated care at bedside. And that's what we're going to see. That's essentially, in the last 10 years, EMRs have come into fashion, so you might see your doctor and then see them at the computer, and then they're trying to balance seeing you at the same time as typing in orders. But I think in our next generation, we're going to see that evolve, which it'll be seamless. We use scribes at some locations to help with the note-taking as we examine patients, and then it gives us the ability to extend ourselves to evaluate the patient and then talk about the results and things.
And I know that when you were in the heart of research and development with your colleagues developing the Vibe 1 chair, you were most likely thinking about this, and the end result was, in many cases, if you walked in the living room and you saw your chair, the Vibe 1, in someone's living room or recreational area, they would assume it's part of an athletic exercise program.
Sure.
So you've streamlined it, and it's...
Yeah, and that's something, is the usability is absolutely key. And you look at usability for the end user, you look at usability from whoever's going to be operating the equipment. And in our case, it's typically a treatment administrator is a physical therapist, occupational therapist, maybe even a personal trainer, or it could even be a skilled nurse. So you've got a lot of different people that are going to be interfacing with it. So when I first developed the technology, I found an effective signal. I said then, how do we deliver this safely? Resolved that, brought on lots of key advisors to the team to help with that. But then the usability, the accessibility to the patient was the next factor. And so we've spent a lot of time refining that. And so we've went from the VibeTech 1 to now the VibeTech 2, which we just put in our first therapy department, actually just in the last 2 weeks. And now we also have a home care product that we are definitely making sure that that usability factor is there, and we're designing it in a way to make it so it fits into the home environment. We actually are engaging a furniture artist to make sure this is something that looks good and doesn't look medical in the household.
See, there you go. There you go. Yes, sir, you have a question.
I do. Your chair sounds terrific, doctor, and good for people who need some kind of therapy. But have you ever thought of putting that into a YMCA or some physical fitness facility so that somebody who is not injured could continue to either gain better strength and health?
Absolutely, and
than they have?
that's a great question. And I think as we get away from the focus on treatment and taking somebody that's already injured, how do we prevent that from taking place? And places like the YMCA's, fitness centers, there are a lot of medically oriented fitness centers that now have a therapy office right there. And so we're kind of crossing between a therapy department and a regular gym. And I think that's going to be ultimately the future direction of things. And it's something that we are actively talking with a couple of different YMCA's right now about implementing programs, piggybacking on the Livestrong program for cancer survivors with our product, integrating into some of their existing programs so people get used to it, working with the personal trainers so that those folks that are receiving personal training can get the benefit. Also looking at developing new programs, for instance, for Parkinson's patients, or even for prehab. Before you go in for an ankle, hip, or knee replacement, you can get stronger. And then, when you're done with your rehab, you'll want a maintenance program to reinforce those benefits. And so that's the perfect environment for doing that.
Well, Dr. Lewis and Dr. Acharya, I know that you both feel very strongly about the benefits of technology as it relates to home health care, but I also know that you embrace the need for socialization in the healing process and in quality of life. So there has to be a balance too, right?
Yeah, absolutely. I think, so my practice is emergency medicine, so I take care of patients when they're ill. We want to prevent them from getting ill, and we talked a little bit about primary care. It's important for primary care physicians to be able to spend time with patients, talk to patients, go through labs, and really explain to them, what they need to do with their risk factors so 10 years from now, 20 years from now, they're not seeing me in the emergency department. That would be my goal. My goal would be to treat patients before they come to my emergency department. Because if you can optimize your health care with some of these things, like the prehab is very interesting because here you have someone strengthening before surgery, which completely makes sense, but how do you strengthen someone before surgery if they're already having pain? And this facilitation, seems to help that. So similarly, how do you prevent someone from getting ill when they know they're likely to get ill because of genetics or whatnot? But there is limitations, and we talked a little bit about primary care.
Yeah. And I think it's also important that, that you're training students and helping students figure out that overall what they're doing is they're going into a service industry. The ultimate thing that students are going to medical school for, everybody says, well, I want to help people. Well, of course you want to help people. We're hoping that's the case. So, but medicine at its core is still human interaction. Even if you're in a telemedicine environment with all this new technology, you still have to find ways to connect with your patients, establish trust. And so while the technology is fantastic and it's going to be able to do a lot to promote, I think, real access to quality health care, you still have to be encouraging students and in their training as undergraduates and in medical school and then their trainings on the job to keep the humanity as part of this. These are actually people, so it's and people know this, but I think it's going to be important to continue to emphasize that as we have, generations that are coming forward where texting is normal. I remember when I was a kid, if I wanted to go play with my friend down the street, I actually had to get out of my house, go down the street, knock on his door, and ask if Craig wanted to come out to play.
Right.
You know, in today's society, you know, often they're communicating completely online, and that's their form of interaction. So when you're talking about people who have need of healthcare, they're scared, they're confused, they're frustrated. It's important that while the technology is still there, we're still emphasizing in our students, you know, from, you know, high school all the way through the continuum, that they're treating people and the humanity has to be there. The technology is a great tool, but it doesn't replace the humanity of what needs to happen in order to provide the best care for your patients.
Yeah, the sense of being cared for is
Certainly.
And someone who
very
believes in
compelling.
you and that you can get better, you have to find a way to convey that if you're doing it remotely. That's going to be an art and a skill set that I think still needs to be developed.
Yeah,
So-
and you know, and the conduit to that is you know, there's a certain number of physicians that are out there. Then there's a certain number of mid-levels out there we call APPs or NPs, and there are rural areas. So, for example, we have an emergency department where we have a combination of physicians and APPs that actually run the department, and then they have a telemedicine connection to a physician that's offsite when they need them to be involved. So they're highly trained. So that's where the hands-on is. So there's the hands-on of a provider at bedside, but yet then the extra, you know, secondary brain of another physician to run cases by and then help facilitate the care. So when you need a higher level or a transfer, then you have the ability to, you know, phone a friend on those cases. And that's the important thing. I completely agree with you. I think medicine has to, you know, have humanity to it. You know, I alluded to you. You had mentioned how the device is now going to look like it's part of your living room, and that's what you want.
I love that.
What you want, yeah.
You want it to
Seamless.
be able to be seamless, fit in there, and the user interface is clean, but yet bring back, you know, why we went into medicine.
Well, I know that you were instrumental, Dr. Tu, years ago in helping write the protocol for emergency response as it was embracing technology. Looking back on that now, what have you learned from the field that you are now applying in terms of personal interviews and personal exams through imaging from people's homes?
Yes, yeah. So this is really cool because, you know, when I finished medical school, you know, when you're at an academic center, if someone came in, they were having an active heart attack, you got an EKG, it shows they're having an active heart attack. You would call your resident, they would call the fellow, then they'd call the attending, and then about 90 minutes later, they'd go into a cath lab. Now we've come to a point where an EKG is done at your house when you're having the chest pain. The EKG is sent to the hospital. We see the ST elevation. The paramedics identify the ST elevation, and the paramedics are actually making the diagnosis. You know, Dr. Acharya, I have a patient who has a STEMI, which is a ST elevation myocardial infarction. We contact the cath lab. We contact the cardiologist, and sometimes as that patient is simultaneously coming to the emergency department, you have a cardiologist who's already at bedside ready to take him to the cath lab. So now we've gone from 90 minutes to, you know, 17 minutes. And that's where the technology has made its advances. And the cool part about this is it also gives a feeling of doing something. You know, the paramedics are doing a great job out there. They work hard hours. You know, I love the fact that they can make diagnoses of strokes in the field, activate our stroke team, activate our trauma team, activate our cath lab. You know, it's important to have everyone work together as a team. That's the most important part.
You know, you mentioned how this technology development has really cut down on response time, and no doubt it's life-saving. How often have you had moments where you have thought about, man, if we had this 5 years ago, I could have saved this guy?
Oh, yeah.
Does that go, did you?
Yeah, you know, absolutely. It's, you know, I lost my father to heart disease, and you know, you think about, you know, it's strong in our family history as well, and you think about all of those patients that are out there that could have had different outcomes, absolutely, and that's where the forethought goes, is to stay ahead of the game, you know, like try to, you know, disease is fighting us, you know, we need to fight disease, and when it goes from primary care to preventive medicine to making diagnosis as fast as you can, it's important. You know, I always like to remind everyone about strokes, because strokes, you have a very short window of time to make a decision to treat.
Yes.
And if you miss that window, then you're left with another 10 to 15 years of debilitation, and it's not a good life to have to lead. So identification is key.
We've only got about 30 seconds. As an inventor, how do you keep that focus on the patient? The excitement of inventing something has got to be overwhelming.
Well,
But
that's key.
the bottom line, how do you stay human?
Well, and that's always been at the forefront is, keeping that patient-centered focus is what can we do to really get the best outcomes for that patient? How do we engage them? Only 30% of patients that are prescribed physical therapy complete their full regimen. Only 30%. What can I do as a technology developer to get people to be more engaged?
What a drop-off that is.
Oh, and that's a lot of lost revenue for the hospital systems, for those that are providing the care. But it really comes down to what can you do to really get that best interaction with the patient.
Yeah, and despite what the focus group is saying, oh, you can make it, you have to discipline yourself to say, yeah, but the bottom line is we're trying to help somebody.
Absolutely.
Yeah. Isn't this a great group of folks? They're wonderful. Special thanks to all of you for being part of our audience tonight and to contribute to our presentation. We learned a lot. It was wonderful. And of course, we have to thank our gracious hosts here at UW Parkside for hosting our gathering. Of course, our longtime partners for this series, the Helen Daniels Bader Fund. Thank you so much at Bader Philanthropy for their ongoing generous support. Also, we've got some great information on our Milwaukee PBS website about all of our different series, but including Community Conversations. All you have to do to see a previous episode or more backup material or breakout separate interviews is sign on Milwaukee PBS and just follow the links. It's very easy. I'm Mark Segrist. For all of us at Milwaukee PBS, thank you for being with us. Take care.